So this is Dr. Dahabra again. Today we are going to do the injections for the spider veins and for the varicose veins. We use Asclera here, which is the gold standard for spider vein and varicose vein injections. She has different kinds of spider veins in different areas, and then she has some, if you look closely, the varicose veins under. And I like to also inject these veins because they are called reticular veins, and they are the feeders. They feed all these small spider veins on the skin. So if we inject only the skin ones, the superficial ones on the skin, then they tend to come faster. So we also try to, catch these bigger veins and inject them, and hopefully, we'll eliminate these veins for a longer period of time. This is the Asclera syringe, and the needle is very tiny. It's 30 gauge needles. It really doesn't hurt, a little discomfort, but that's it. Okay, you ready? You can never be ready for a needle. You'll be fine, okay? You'll see, it's not bad at all. Let's get some blood and then we'll start. As I said, I always like to start with the varicose veins, the bigger ones. So, and then let's gonna start a little pinch. Perfect. Okay, I see blood, and then I'll do the injection. These bigger veins, the varicose veins, they need a little bit more volume. Okay, I'll hold it a little bit so that the medication stay there and sclerose the vein and doesn't just go to the bloodstream, which doesn't harm, but then it wouldn't be efficient. Okay, you can see it's very fast. Actually this appears pretty fast. She has many of them here. Okay, another injection. You can do it from this angle. Okay, you can see it in front of your eyes how the veins actually are disappearing. Okay, this do injection for the superficial ones. Superficial one take less volume, but we need to do more injections. Okay, this big one, try to catch it. And then we have to little more volume, as we said. And then this area, we'll leave it for a few weeks. We can always come back and re-evaluate just in case if it needs more injections in the future. The areas that we don't get to inject today, we can inject again anytime. All right, so already looking better. There's another big one here. I always like to catch these big veins because, as I said, actually they improve the look of the superficial veins as well, the spider veins. Okay. All right, let's do another area. Okay, so this the same. You can see the green coloration here is the vein under the skin. Try to do a little pinch. I see blood, aspirate, and I inject. Okay. See the vein, the coloration disappeared. Perfect. See, and then these superficial ones you can go after we catch the big ones. You can see, look, superficial ones, look how it's gonna disappear. You see that?
Disappear right away.
Yeah, beautiful. superficial ones, you can see them disappearing, you know, even the big ones in front of your eyes. Yeah, it's appeared. Doing good. Bother her, right? Yeah, sure. How did you find about us? We finished the front and then we are looking at the back. It's the same thing, you know, we have the same thing. If you look, we have the spider veins, the superficial ones, the tiny little ones on both sides, and under you have the green or blue discoloration for the bigger veins, the varicose veins, also called reticular veins, and they supply these small ones. So we have actually to try to catch and sclerose both of them, the bigger and the smaller ones. Okay, we're gonna start them. All right, so you see the green and blue discoloration here. That's the vein. A little pinch. All right, I go, little pinch. I try to aspirate and I see blood coming back, so I know I'm inside the vein. And we have to put a little bit more volume here to sclerose them, and I'm trying to occlude the vein so that the medication stay there for a few seconds before I release. And gone. Same. Next neighbor. Try to get some blood flow. Here it is, I see it. I'll wait a few seconds. Okay. And we'll work our way up. Sorry. And we use Asclera because it stings actually less than hypertonic saline, and it's a gold standard nowadays. And at the same time, it causes less discoloration, you know. After we do these injections, part of the blood inside the vein will go outside and it might bruise the area, you know, a little bit. It's less with Asclera, you know, but still it will happen, and these areas might get a little worse before they start getting better, potentially. And this vein is also gone. As I said, we're working our way up. I'm doing good. Okay. Yes. All right. Let's just do one here. Okay, let's just do these superficial ones. If you can get close, you see these spider veins. These are very superficial, so the needle really has to be superficial to the skin. Okay, this one is up disappears completely. Same here. Let's just show them this one here. It's nice spider vein. And let's just go. Oh man.
Disappear.
You saw that? It's like magic.
Ow! That was good.
Okay. This side already looking way better. We'll work a little bit on the other side and then we can always come.